I'm Dr. Clovis Ibomana Akili, the resident gynecologist at St. Francis Community Hospital. I say welcome all pregnant mothers, where we are journeying with you from the conception all the way to the delivery of the baby. And even after the delivery, we give you the way to go for the pediatrician. At St. Francis Hospital, we have our obstetrics and gynecology clinics, which run from Monday to Saturday of the week, from 9 a.m. to 3 p.m.
Our aim at St. Francis Community Hospital is just to make you in maternity feel like a home away from home, a small B&B.
We'll still be coming here with my baby because I love their services. I highly recommend it to the rest of the mothers who are expectant and even those who are not mothers. Karibuni sana.
A very good morning to you, dear viewer, and thank you very much for joining us here for another episode of Health Corner Show right here on Capuchin TV with me, Maureen Kimani. And of course, today I'm very delighted to be here at St. Francis Community Hospital in Kasarani. We are bringing you live conversation about maternal health care. And of course, we shall be delving deeper into this conversation, getting more to understand what is it all about. And of course, it involves all the mothers in our families and in our community. And we shall be exploring on why is it important and how this conversation and how better healthcare, that is a maternal healthcare, can save lives and future healthier. And joining me for this conversation is one of the representatives here at St. Francis Community Hospital. We shall be introducing himself in just a few as we get to know more about our conversation today. And in case you'd love to be part of this discussion, please do not hesitate to reach out to us on 0717 424 866, or you can use our SMS number, that is 21760. As we continue with that discussion, you can leave a comment. You can definitely make sure you interact with us by even asking a question, and by the end of this conversation, we'll be getting back to you. But first, allow me to introduce my guest here with me today, Duncan. A very good morning to you. Hello.
Good morning to you.
Thank you very much for hosting us here today. It feels good to be here.
Thank you. And welcome. So, my name is Mugambi Duncan. Mugambi is a midwife at St. Francis Community Hospital, Kasarani. So, St. Francis Community Hospital is located in Kasarani constituency, in Nairobi County, along MICROFINANCE. So, for our client, for our patient who wish to come and enjoy our services, we are located in Kasarani constituency along MICROFINANCE. So, St. Francis Community Hospital is a level 5 teaching and referral hospital, offering a wide range of services, cutting across from outpatient services, inpatient services, and specialist units and clinics. So, among our outpatient services, we have general patient services, emergency services, specialist clinic, we have orthopedic clinics, dermatology clinic, pediatric and pediatric surgery clinic, surgical clinics. We have rehabilitation and physiotherapy services. We have gynecological services, eye services, dental services, among many others that are outpatient services. Going again, we also offer inpatient services and specialist units among the inpatient services. So we have one of the inpatient services, maternal services. So we offer maternity services, and this is where now we'll be focusing on today. Among other services, we have eye independence unit services, intensive care unit for both adult and neonates, and also pediatrics. So we have other renal services, which was made part of inpatient services. So those are just among the few. We have a quite number of services that we offer St. Francis Kasarani Hospital.
Okay, all right. I'm very delighted to be speaking to you. The fact that we are having conversation that touches all our mothers, all the women, but you can definitely see we are talking to a man, and of course the men definitely work together with their ladies to ensure that they walk this journey very smoothly. So for the first maybe person who is hearing about this conversation about maternal health care, could you kindly shed more light about what is it all about? What does it involve?
So thank you. So maternal health care is one of the interesting topics to discuss. I myself I'm a midwife. So a midwife is any other person who is trained and licensed to deal with a pregnant woman in the 3 periods. That is during pregnancy, during childbirth, and postpartum. So a midwife can be either a woman or a lady or a gentleman.
Okay.
So for our kids, I always say it doesn't require me to have a uterus to know how uterus look like. I don't need to be pregnant to know how to deal with a pregnant woman. It's only require you to have a skill and knowledge on whatever you need to do to take care of this pregnant woman. So basically maternal health care is a well-being, it's a general medical term used to define or to refer to the well-being of a woman during pregnancy and during childbirth and postpartum. So this will cut across the 3 aspects, that is both among the maternal health care we'll now be looking at the both aspects, that is physical aspect, emotional and psychological aspects, social and economical aspects. So for you to say that this woman is enjoying her maternal health, the whole aspect should be complete. So maternal health encompasses of both mental health, that is part of psychological aspects, and socio-economic aspect. This mother should be able to reach out these services, the maternal health services. So physical, the mother should be physically okay to access these services. So going down now, this is what forms the pillar of the maternal health. So for you to say that this mother is enjoying a full package of maternal health, this mother should be able to access the following services. One is maternity service, which we offer at St. Francis Hospital, and in our maternity department we offer antenatal services. We offer both promotive and curative services, preventive services, delivery and labor monitoring services, and among them is the mode of deliveries. So at St. Francis, being a teaching level 5 teaching and referral hospital, we have different mode of deliveries. So we offer both normal vaginal delivery, both assisted vaginal delivery, and cesarean section deliveries. So among the elements or the pillars of the maternal health care is access to emergency obstetrics care. So a mother comes for a normal delivery, but in the process, maybe the labor complicates and we need now to get to an emergency care. So one of the emergency care we give is cesarean section delivery. So any mother seeking services as far as maternal health care is concerned, this mother should enjoy the full package. And this package involves family planning, emergency obstetrics care, antenatal services, and postnatal services. So,
and could you kindly expound on, when you talk about antenatal care and postnatal care, kindly expound those terms to our viewers for them to work as, to work together with us.
Okay. So antenatal services are given to a pregnant woman while the mother is pregnant. So these services now start as early as when the mother realizes that she is pregnant. Or when maybe they are planning during the preconception period when the mother or the couple is planning to conceive. So among these services, we have screening. So all pregnant women should undergo the process of screening, and this occur or happen during antenatal visits. So antenatal visits, we have a wide range of activities that we carry on during this period. One is screening. We screen for the maternal health. We want to make sure our mother, as we journey with her during the pregnancy journey, the mother is well and healthy, both the mother and the baby. So we do screening services, and this is where now we screen for the maternal conditions such as diabetes, hypertension, anemia, malaria, HIV and AIDS, hepatitis B, syphilis, among many other diseases we screen during antenatal period. Then we do a lot of health education for the mother. All mothers have right to enjoy maternal health education, and this happen during antenatal period. So we give our health messages for every mother, focusing on whatever we call focused antenatal care. So we want to have one-on-one conversation with this mother who is pregnant, so that we get to know how to journey with you and how to help you during the period of pregnancy. So in that period now we offer a wide range of maternal health education, and one of them we capture on nutrition, diet, ambulation, or maybe the exercises. Positive health practices during pregnancy, we call them pregnancy health practices. Then we also give the supplements to aid in the fetal development and growth. We screen for them some of the conditions that may affect the baby. That's when we do an obstetric ultrasound during the antenatal period. So generally we want to make sure the mother and the baby are well during the period, so that we have a positive experience during childbirth. And now we transit back now after delivery. Now that is when now we get into postnatal. Postnatal meaning now that this mother has undergone through the childbirth process, we have delivered the mother. So now we are continue with the other part of postnatal. So postnatal means now the mother has delivered.
After.
Yes.
Okay, and I understand you put a very weight when it comes to antenatal care, and sometimes you've ever had some of the scenarios where a lady came to realize after 3 months she was pregnant. What happens in such cases? The fact that you say that antenatal care should be definitely after you've realized. And by looking at these, you've already missed some of the session, like we're talking of 3 or even 4 months. What happens, or maybe you can tell us your experiences here at St. Francis Community Hospital. What are your thoughts on that?
So it's very common to miss to know whether you're pregnant. In most cases, most come the 2nd month or the first. For those who are keen, they can come the 1st month. But you can even come at that month. This is now when you realize that you are pregnant. So when a such occur, we advise them now to start their clinics as now that they have realized that they are pregnant. So now we take them through the process, what is expected, what they need to have during the process of the pregnancy, and we encourage them, because sometimes they may take it negatively because they were not probably they were not planning for the pregnancy, and that's why they took a lot of time to realize whether they are pregnant. So but when they realize we have done the screening and we have confirmed that they are pregnant, or maybe they have done the test, so we now start journey with them. We enroll them for our clinics, where now we provide the antenatal services and care to them, as we give them whatever they need to have. One of the things we discuss with them is they accept the pregnancy. So it's embracing. So once now they come to accept the pregnancy, then now we start with them, journey with them for the guidance. So we do screening from that very first day to make sure the mother is not suffering from any other thing that might hinder her journey in pregnancy. So we start the screening, we enroll them to our antenatal clinics, then now we do follow up until they come to accept the situation. So in that time we discuss things like now individual birth plan. These are mothers who are not planned for the pregnancy, so we need to let them know whatever they need to have in the whole journey. So one of the things we discuss with them is individual birth plan. So how can you make your journey smooth? One, among the package of individual birth plan is where will you deliver? So the mother will start preparing them as early as possible. So you get to know where you deliver, the place of delivery. The companion who will be accompanying you for the clinics and maybe during the childbirth and the whole process. So we help them to identify, or we guide them to identify the partner for those who have the partner, or maybe the next of kin. So we advise them to be accompanied by someone who will be journey with them, encouraging them and bringing them for the clinics. So the means of transport. Most of us, we live in times of uneconomic. So we need to help them to be able to plan on how they will be coming for their clinics, their fees for the consultations, the package for the delivery packages, whatever they need for the package of delivery, all those we include during the first time. Then we screen the conditions that may affect the pregnancy. So then we let them know their status. We share the healthy messages that they need to know, and we keep on repeating until they get the time of delivery, so that this mother feel that they have someone who is journeying with them. Yes.
All right. I understand the government is really trying when it comes to maternal health care in terms of educating the mothers and making sure that they give birth very safely. When it comes to young mothers, because you find there is that person who is giving birth for the very first time, they are worried, what is it going to happen? And of course there are some times that you find in some cases exactly maybe you got the first child, of which it was a twin, and then you get a triplet. What does it happen? Because already you're in a shock, you had not planned for these. Because I understand that you mentioned very clearly when we were beginning with the conversation about mental health, especially when it comes to mothers. Please tell us more about that. What happens?
So when the preparation begins during the antenatal clinic. So in the process of screening, you realize, you get to know the state of the baby, the number of babies you are carrying, the position of the baby, the presentation, all those things are captured during antenatal. So the healthcare provider who is journeying with the patient, or maybe the mother, during antenatal period, make sure they cover the whole aspect of care. So this mother is the first time mother who might be facing challenges maybe with the pregnancy itself, the family support, or maybe any other social issues during pregnancy. So during the clinic or the sessions that you are having with the mother, so you get to encourage the mother and support the mother, despite the number of babies, whether triplets, whether twins, whether single baby. So you advise them on the best mode of delivery. When you realize maybe the mother is the first time mother and they are carrying the triplets, then you discuss with them the possible mode of delivery, so that they prepare psychologically that I may not be able to deliver normally because I'm carrying triplets. Or maybe if I deliver normal, there might be one complication to happen, being the first time mother. So this mother is prepared as early as during antenatal visits. So that mother, by the time we are getting to the childbirth, so this mother is prepared. That's why today you find mothers will just come for an elective cesarean delivery. Simply because they understood their situation during the antenatal visits, that the position in which the baby is lying cannot allow for a normal vaginal delivery. So the best mode of delivery, which she was advised, is cesarean delivery. So with that mother will not be having now that anxiety, that fear, that will I survive the cesarean delivery, because she understands what is cesarean section delivery. Yes.
So what you're trying to say is that our obstetric ultrasound scan is very important during a pregnancy.
Yes.
Okay, and what happens, because you've ever had some women saying, I don't want to go for a scan, I'll just wait for it to be a surprise if I'm having a baby boy or I'm having a baby girl. How do you work through those mothers, especially here in our hospital?
So I think when you hear mother saying, I want it to be a surprise, I don't want to do a scan, so it's now our responsibility as the healthcare provider to let this mother understand why is it important to do an obstetric ultrasound. So an ultrasound during pregnancy communicates a lot to both the mother and to the healthcare provider. So when you carry out an ultrasound will give you agenda. So you as the mother, you are able to know how to plan yourself for the childbirth. So when you do an ultrasound, you are able to know what are the gestational age, how many weeks, how many months the pregnancy is. Sometimes mothers will come without knowing their last time they saw their menstrual period. So they're not sure of the dates. So we need to do an ultrasound to confirm the gestational age of this mother. So that is the importance of the two main importance for the ultrasound to the mother. To the healthcare provider, an ultrasound covers big aspects. One, the gestational age. So me as the midwife, me as the healthcare provider journey with this mother, I'll be able to know that the mother is at this gestational age. So I'll be focusing my health care or health messages based on the gestational age. Then you are able to know the presentation of the baby. So that I'm able to advise the mother on the best mode of delivery. So the baby is in this position. Now this position will allow us to undergo the normal vaginal delivery. The presentation of the position will not allow us to proceed with the normal vaginal delivery. So the best mode of delivery is either cesarean delivery or assisted vaginal delivery. So the other aspect that will be captured is the amount of fluid in that amniotic sac. So which play a very important role in the fetal movement during pregnancy, and the state of the placenta is also captured among the aspects that are covered in the ultrasound. Any risk, like we have the con, you hear mother saying, I end con around the neck, then baby after doing the scan, the boy gonna con around the neck. So these are some of the things that we look into when it comes now doing an ultrasound during the antenatal visits. So it gives you a clear image as a healthcare provider on whatever to prepare during childbirth and how to advise the mother during the process, either during antenatal or during childbirth. Yes.
Okay, and how would you describe the statistics when it comes to maternal mortality, especially in our country right now?
So recent statistics have shown a decline in the maternal death. So one of the things that you realize that maternal health is a global thing. So in the globally we have the targets. So when you look at our Millennium Development Goals number 5, so we have two main targets. So MDG 5, we have part A and part B. And part A, we are trying to target 75% reduction of maternal mortality rate. So, and now part B, we are trying, for us to reduce this maternal mortality rate, we need to focus on ensuring universal access to the reproductive health. So that's why our government, our institutions are working hard to make sure the maternal health services are accessible to all mothers despite of economic status. So we have programs that support the mothers. Initially we had the mama programs, we have the NHI for the SHA programs, we have accessibility to the maternal health services, even to the level of these health centers. So, and now they have made our referral system easy for the mothers. In case of any complication at the lower levels of health care, so we have a transition to a referral hospital. So, we have no exact numbers of how much we have declined from the previous statistics, but the studies have shown a decline in the maternal mortality rates. Yes. Okay.
And to take you back, you talked about nutrition, and you mentioned it has a very huge impact when it comes to, all these process of maternal, healthcare. And sometimes you find women, they have cravings during this period. Unasikia mtu hata anataka kunusa mafuta ya taa. That's what people joke about it. You want to have those fries. You know, those cravings. As a person who have walked through journey with these pregnant mothers, how do you feel the nutrition bit is very vital to this process?
So nutrition is very key and essential to the mothers during pregnancy. And this is one of the topic we discuss during antenatal clinics. And sometimes we may be forced to involve a nutritionist for further guidance, because during pregnancy there are a lot of changes in the bonding, including the hormonal influence during the pregnancy. And this is what brings about the cravings. And now we want this mother to have healthy pregnancy practices. So we don't want them to have a situation where they are craving for something that is not healthy to their body and the baby's health. So during antenatal visit, we talk to them the best food that they can have during pregnancy, and we caution them on whatever they should avoid. Because when you crave for something that is not, that will cause harmful, or will be harmful to your health or the baby's health, then that is posing a risk to you and to your baby's health. So at every clinic, from the first encounter you come across this mother to the end of pregnancy, we always talk of nutrition, touching in details on the specific foods that this mother should take. The carbohydrates, which are the best carbohydrates for them, the proteins, which are the best proteins for the mother and the baby, the vitamins and the minerals. And then we go an extra mile and them the supplement, because sometimes they may not be able to access the food that are rich in these nutrients and minerals. So we supplement them with the calcium, the folic, and other supplements, so that they may aid in the development of the baby. So when a mother is having those episodes of, we call them pica, or maybe the cravings, so we discourage them, because when you want to take swell, and because we're craving for the sweat, then that is causing negative health impact to your body and to the baby. So we want to let the mother understand why are we saying that we need to avoid these health practices, why we need to adopt these healthy practices. So that is what we do in every clinic. So when we get a challenge during the conversation on one-on-one during antenatal visit, we are forced to involve a nutritionist. So we call for a nutrition review, so that the mother get to understand the component of the foods that she should make sure that during a meal they are part of.
All right. Thank you very much, Duncan. As we continue to engage with our conversation, I can see we have some people who are following a conversation, and of course we have a question for you here. I didn't get the name. Does your hospital give only maternal health care, or they can also treat other illness? I think you can be able to answer that as we continue.
So we don't only offer maternal health services. We have other services like gynecological services, which is part of reproductive health. So maternal health covers both antenatal clinics, both maternal and child welfare clinics, and maternity services themselves. So maternal health is a general term, as I was saying earlier. That's a general term used to refer to the well-being of this pregnant woman. So we start as early as during antenatal visits, and now we have antenatal clinics. So during antenatal visits, we may identify other reproductive related health issues.
Yes.
During antenatal visits, you may realize that this mother is having other maybe gynecological related issues. Like we have mothers who are pregnant and they have fibroids. We have mothers who are pregnant and they have gestational diabetes. So we have mothers who are pregnant and they're suffering from maybe mental illness. So we do not only focus on maternal health when dealing with a pregnant woman. So we need to ensure the all aspect of care is given to this pregnant woman. So, and we need to take care of mental health for this pregnant woman. We need to take care for physical health of this mother, social and economic health for this mother. So during antenatal visit, you are able to identify some of the risks that may occur during pregnancy or during childbirth. So there is a point where you realize that this mother is having maybe a gynecological issue, but she's pregnant. So we need to refer this mother for a gynecological review. So we incorporate other disciplinary team amongst our care. So a mother is suffering from a mental health, but she's pregnant. So we need to journey together with a psychiatrist so that we are able to help this mother achieve the optimal care as far as psychiatric health is concerned. So we realize maybe this mother is having a nutritional issue. So we bring in the nutritionist to get to discuss with the mother on matters nutrition. So we have other things like maybe we having other family issues. So we bring family medicine physician to discuss with the mother on family matters. So we do not focus only on maternal health services. So maternal covers other services among it.
And of course, as you can look at this banner that we have here, you have other, special clinics here at St. Francis Community Hospital. And you can definitely walk in through any time you want to have any queries about the hospital. What are some of the services they offer? You can definitely come in and you'll be able to experience and work together on these services. I wanted to talk more about the mental health. Because you understand that during this process, the pregnancy period, the delivery period, it can be a bit stressful. And you find mental health issue is actually a very big deal in our country right now. What are some of the, do you offer counseling during this time? Do you help mothers to overcome, how to deal with these stresses when they come during this emotions period? How do you go about that? Do you do a follow-up as well?
Thank you. So mental health is one of the public health concern, and it affects anyone, including a pregnant woman. So mental health issue, as I said earlier, we cannot ignore that aspect of care to a pregnant woman. So that's why we are targeting that this pregnant woman should be able to access all these services at one point. So luckily that St. Francis offer those services. We have the counseling and psychiatric services, so we offer them. So when we realize this mother probably is suffering maybe from a mental illness, or maybe stress is also a mental illness. So pregnancy itself can give you those stress, family itself can give you stress, the journey itself can give you stress. So especially when you are maybe first time mother, you are not planning for the pregnancy but it has come, so that is itself a stress. So during these sessions we get to, that's why we are now saying we are focusing on one-on-one. When we are discussing one-on-one, you are able to vent out whatever you might be undergoing. So you are able to share whatever you are facing, and now we are able to help you. So during the conversation, during antenatal visit, you are able to identify this mother might be suffering from something outside the normal pregnancy journey. So from the history you have taken, from the way you have seen the journey, so you are able to advise the mother to either seek the counseling session, or maybe we bring in the team, the counseling team, to get to share the experiences, maybe the journey, or maybe we have other mothers who have and a history of maybe mental illness during pregnancy, and then maybe come in, we share together, and now you get relieved out of whatever you are going through. So we have a team. We combine both PMTCT, because we have those people who are trained to deal with the mothers during this period. So they get to counsel them the counseling psychologist discuss with them, and then they get to see they have someone who can journey with them. So it's a matter of just venting whatever you have, maybe whatever you are suffering from, then we are able to help you during this period. Yes. So we have the services at St. Francis. Yes.
Okay. And what are some of the signs of pregnancy complications that women need to pay attention to, and they don't need to ignore? Once like you see this thing is happening to me, you need to go to St. Francis Community Hospital to ensure you talk to your doctor and communicate on what is going on with your body so that you can get help. Because sometimes I feel, we Kenyans very reluctant to some matters, and you wait until the complication becomes a very huge, big deal to you. That is when now you start rushing to the hospital. Why is it important to pay attention to your body changes as a lady, as a pregnant mother?
Okay. So during pregnancy, there are so many changes that take place in the body, and we say during this visit we discuss, amongst the things we discuss with them are danger signs during pregnancy. So danger signs, these are things that we are not supposed to see during the period of pregnancy. So, and when you see them, they communicate something in your body. So one of the signs that you should not ignore is swelling of the feet, the arms, the face, or maybe the whole body. So that is a sign. Sometimes you hear mothers saying swelling the lower feet is normal during pregnancy, but should not be ignored because it might be communicating something. And one of the serious things that come out of the swelling is preeclampsia. So when a mother is suffering from elevated blood pressures and protein in urine and generalized body, so they will see the generalized body swelling. So the mother may think it's normal thing, but it's not normal. So when you see such signs, get to know the blood pressure of your body, so that now we get to know is it, and get an assessment to get to know whether it's normal. Because swelling, yes, it's okay. It can occur during pregnancy, but again, it should not be ignored. You need to get examined or maybe assessed, so that you are reassured that it's okay, the pressure is okay, so that you are not at the end of the pregnancy you may not have a complication out of it. So the other sign that you should not ignore during pregnancy is headache, blurry vision. Sometimes mothers say, I've worked for long and this is probably why I'm feeling this. This is not the case. It might be communicating something again. One of the big things that come out of it is anemia in pregnancy. And that's why I said we are giving this mother the supplement to take care of one of the major type of anemia that comes during pregnancy is iron deficiency anemia. So that's why we are giving the mother the supplements to cater for the supplements that are required for the bonding during the pregnancy growth. So when a mother feels dizziness, general body weakness, blood vision, so it might be communicating two things. Either the blood level is too low, or this mother is having elevated blood pressure in the body. So it's always advisable that you should not ignore this. Go to a medical facility, go seek health professional guidance to get to know where the problem is. Yes.
All right. And how can families, how can spouses, how can relatives ensure they assist and work together with these pregnant mothers in their families, in their homes, to ensure they give them an easy time? How can they support these pregnant mothers who are going, different changes in their body and how they feel? What are some of the things they can be able to do to work together with them?
So, a partner, maybe a partner or maybe a spouse, plays a very important role to this pregnant woman. Companion is one of the things that can make a mother feel appreciated. So, we encourage the spouses to come for the antenatal visit. As others realize that they are pregnant, even the time they are confirming that they are pregnant, let them come, both of them, so that we are able to discuss with them as a family. So we want, after the delivery, they go back again from a healthy family. So we encourage as others they realize maybe they are pregnant, they start coming for the clinic, both of them, because we do screening from both the mother It's always going to do screening from both the mother and the partner, so that we may not be taking care of this mother, only to realize that the spouse maybe is having other issues that may hinder or maybe become an obstacle for the pregnancy journey. So that is one of the support, that is companion. So at any visit journey with the pregnant man, accompany them to the clinics, get to know whatever doctor has advised them, or maybe the healthcare provider is advising the mother to do, so that we're able to pick some of the essential things that the mother require during pregnancy, to have a healthy baby and healthy mother during childbirth and postpartum. So the other thing is financial support. This is a pregnant mother who is having so many things. Pregnancy can come in with so many things, including vomiting, what we call hyperemesis, bleeding, discomfort, stress, so many things. So they need support, financial support, that they need to go and access these services. So when they want them, they are scheduled for the antenatal visit, they're able to go and meet the healthcare provider. So they have the means of transport. They are not walking from all the way from Nairobi town to Kasarani by foot. So they have a way to reach to St. Francis. So they also need to access, when they are scheduled for maybe a test or maybe a scan, they're able to do the scan. Because sometimes mothers may not be having the capacity to have the ability to do all those things by themselves. So they need support. Then the family support itself. So they are appreciating the journey, the pregnancy journey. They are providing for you the nutritional value, or maybe the foods that you are advised to take. They are, all those things they are supporting. So partner is maybe the mother, maybe the spouse, maybe the family members play a very important role to this pregnant woman during the pregnancy journey.
Okay. Yes. And how does exercise bit of it fall into place? Because sometimes you find, as much you're saying, like the mothers should not walk for long distances. According to my knowledge, exercise is very important, especially for the pregnant mothers, because it helps them maybe to ease even the delivery bit of it. And sometimes you find, because your body is very exhausted, you just want to rest. Should mothers be allowed to do a little bit of exercises? And for those ones who are feeling they don't want to do anything, is it okay for them to just lay down forever and wait until? How is exercise important to this journey as well?
So exercise during pregnancy is very important, but exercise to a level, to an extent that is guided by healthcare provider. So when you say when you tell mother to have some walks, it's not like walking from Nairobi to Muranga and come back. So that's a vigorous exercise to the mother, which might be having another negative impact to the pregnancy. So we have a range of exercise that are meant for the pregnant women based on the gestational age. So we advise them on some of the exercises that they're supposed to do while maybe at home, and to at what extent that they can do it. Because always those exercises shouldn't be done under guidance of maybe a physiotherapist or maybe a healthcare provider. So to avoid having negative implications to the pregnancy or maybe the other adverse effect to the mother. So walking, or maybe the exercise, we advise them based on the period maybe where they have the gestational age. So there are those packages of maybe the exercise is meant for the mother in labor, mother below that 7 weeks, mother at early pregnancy. There are all those exercises. So we always advise mother to get to know what are some of the exercises I can get to do at this period of pregnancy, so that we are not now will not go and do them, then come to the hospital with a complication.
Okay.
Yes.
All right. And I understand we are almost winding up with our conversation, but I understand there's a lot of information that we need to lay out in discussion about maternal health care. Perhaps you can say your advice to young mothers, to all those pregnant mothers right now, and to even future mothers who are planning one day to become pregnant, what are some of the things they need to know about maternal health care?
Okay, thank you. So maternal health care is paramount to all women of reproductive age. So seeking maternal health services is of good health, and it's one of the good health practices for all women of reproductive age. So when planning as a couple, maybe you're planning to conceive, we have preconception care. So you get to, when you're planning to conceive, get to seek medical health and guidance on the process that require, and the screening, the counseling that is done during the preconception period. Then now once you conceive again, we journey with you from that point. So continue seeking medical advice as others realize that you're pregnant. That is the only way of detecting or managing early complications, and maybe identify the risk factors for a pregnant woman, for you to have a positive childbirth experience and a smooth postnatal care. So in most cases, the challenge we are facing in our societies is that the young mothers, the first-time mothers, are seeking advice from the elder mothers, or maybe their mothers who have delivered before. Every pregnancy has different experience. So whatever mother one will experience is different from the other one experience from mother two. So bodies respond differently with pregnancy. So I might have no experience, maybe I might not have any challenge during pregnancy, the other one is experiencing several of them. So seeking advice from a healthcare provider is the solution for this positive experience, both during antenatal, childbirth, and postnatal. So get to seek advice from a person who has been trained, who has experience from the medical field, because we have other doctors from the community, we have other birth attendants from the community, but they are not skilled birth attendants. So seeking health practice or seeking health advice should come from a skilled birth attendant, or whatever the people we call them midwives, the nurses, the doctors, the gynecologists, obstetricians. Those are people who have undergone through the training of how to handle this pregnant woman for 3 periods. So that is one of the health practice that we encourage mother to do. The second thing is regular checkup and visits. So when scheduled for the antenatal maybe clinic, it's always going to go. Vent out whatever you might be going through the process of in the journey of the pregnancy, so that will get to be assisted by the healthcare provider. So always get to be checked regularly and get advices from healthcare personnel. The other thing, take your supplements, your visits, your advice positively and with a lot of weight, because these are things that will help you to have a smooth journey in the process of the labor and childbirth and even postpartum, to avoid you getting into whatever now we are having, like postpartum, psychosis, postpartum, that is the mental illnesses. So those are some of the things we can get to advise the mother. Always seek medical advice from medical personnel rather than from the community. We have social cultural issues, we have all other things that are against the pregnancy itself. So we need to get to practice what we call healthy pregnancy practices. Yes.
All right. And lastly, I remember there was a question who, one of the viewers who was asking if Kasarani only offer about maternal health care only. And we talked about many other services they can be able to come here to access. Kindly tell us more about the upcoming eye clinic camp on 15th June.
Thank you. So St. Francis Community Hospital work hand in hand with the communities. So we're trying to reach into the deeper areas of the societies and the communities, giving the services that maybe those people who be living below them, or maybe they are at the bottom of the pyramid, cannot be able to access. So we are trying to give them at their point of their homes. So St. Francis, we work hand in hand to offer services, and among them we always have baby and mother fairs activities. We give health messages to the community through the community-based health programs. We follow up our patients to their homes and even follow up back to their clinics. And the recent coming in this month of June, we're having a high medical camp at the PCA circle that is in Kasarani constituency. And these eye services will be giving a wide range of services, including screening, assessment, tests, registration, which is free. Then we'll be having eye checkups. We'll also be giving out the spectacles for those who are having eye issues. Maybe for those who will be having issues that may require surgeries, we have our high surgeons. So we'll be booking for them to come and get assistance at our facility. So coming
on 15th June,
of this June, we are having a medical camp at Siko PCA.
Right.
So we are inviting all people across the world, across Nairobi County and other counties to come and get benefit from these services. Yes.
All right. Thank you so much, Duncan, for sharing those beautiful insights about maternal health care. I really appreciate your time, and thank you for laying that beautiful information to our viewers, and I'm sure they'll continue to spread the message to the community and ensure that we have healthier futures for our babies, for the mothers, and we don't lose anyone, and we make sure that we reduce the maternal mortality. Exactly. Yes. So thank you so much for your time, and thank you, of course, to all our viewers who are following this conversation that was coming to you live from St. Francis Community Hospital. Make sure you join and be part of this community, and that's why it's called community, because it serves the community itself, to ensure that in case you have any complication, in case you'd love to just come and get any checkup, you can definitely visit St. Francis Community Kasarani Hospital anytime. They are very good doctors here, nurses, as you can see from Duncan, and they'll be able to experience a very good health care facility. You have all the facilities inside here, so thank you very much. And in case you are expecting, or you know someone who is expecting, make sure you share these life savings tips to all the mothers out there, to ensure that we encourage them for early antenatal visits. And of course they can make a visit here to see Duncan here, and they will be very glad to, you know, get a healthier baby. Sure. All right. Thank you so much to all of you, and allow me to appreciate we have Pastor Henry Bugita, Pastor Henry from Bogota, who says I'm tuned into the conversation. Thank you so much. And I can see as well we have Kevin Cheriot, who is following the conversation as well. Thank you so much to all of you. Make sure you continue supporting Capuchin TV, and of course be part of St. Francis Community Hospital, and especially for the upcoming ICAM. Please take advantage of these camps. Make a visit and reach out to Kasarani, St. Francis Kasarani Hospital. We have their numbers written down below. You can call them anytime, and they'll be able to get more details on the upcoming camp. That is Eye Clinic Camp on 15th June at PCA. Sheko. Yes. Yes. So, all right. Thank you so much. I'm wishing you a lovely day. Thank you so much, and keep it Capuchin TV. And as we always say, your health matters, and your health is your world. Kindly watch out on what you eat, exercise, and make sure you take lots of water and continue living healthy, and share this conversation to your friends to ensure they also get a healthy conversation and continue living healthy for better life.
Congratulations!
I'm Dr. Clovis Ibomana Akili, the resident gynecologist at St. Francis Community Hospital. I say welcome all pregnant mothers where we are journeying with you from the conception all the way to the delivery of the baby, and even after the delivery we give you the way to go for the pediatrician. At St. Francis Hospital we have our obstetrics and gynecology clinics which run from Monday to Saturday of the week from 9 a.m. to 3 p.m.
Our aim at St. Francis Community Hospital is just to make you in maternity feel like a home away from home, a small B&B.
We'll still be coming here with my baby because I love their services. I highly recommend it to the rest of the mothers who are expectant and even those who are not mothers. Karibuni sana.